Hi, my name is Ashley Stork, and for my senior project, I chose to do dental hygiene as my career field. Over the course of this school year, I've been shadowing a dental hygienist in a periodontal office, which is a little more complex than just your average dentist office. A periodontist is someone who you visit every 3 months if you need things like bone grafts or tooth implants or anything like that that requires extensive care that your dentist cannot provide for you. You see a periodontist every 3 months on top of seeing your regular dentist every 6 months. So you really see a new dentist every 3 months just for people that really have issues going on in their mouth and really need some extra work. So whether you see a periodontist every 3 months or you see your regular dentist every 6 months like most people, at-home care is such an important part while taking care of your mouth. If you don't brush regularly and floss and take care of all the necessary things that you need, chances are your mouth is not going to be as clean and as healthy as you would like it to be. So the first thing that we're going to talk about is brushing. And while being at the dentist office, shadowing my project facilitator, I learned so many tips and tricks and things that most people miss while brushing. And the biggest thing is having the right kind of toothbrush to brush with. Yes, all toothbrushes are great, whether it's just a regular manual toothbrush that you use, or if it's an electric toothbrush, that's even better. At the dental hygienist office that I shadowed at, they recommend the Oral-B electric toothbrush. This is great because it really helps get your mouth that extra clean feeling like when you leave the dentist office. And they really recommend just the small round brush that it originally comes with because that's such a great thing to be able to get in the cracks and crevices of your teeth that you may miss with a regular toothbrush. So not only is brushing so important, but making sure that you cover all your bases in your mouth while brushing is also a very big factor in keeping your mouth clean. So while I was shadowing my product facilitator, she taught me a lot about brushing and a lot of places that most people miss while brushing, and the biggest parts that you need to be sure that you 100% brush completely and don't miss a spot. And I learned so much because yes, everyone brushes and most people know how to brush their teeth just right off the bat, but I had no idea these tiny places that I didn't brush, and I didn't even notice that I wasn't even brushing them, but it's such a big part. So the first part that I want to talk about is brushing right where your tooth meets your gum line. And most people don't brush their gum line because they don't really think about it. They just think about brushing the actual surfaces of your teeth and where you bite in the front of your teeth to make them shiny and white. So another big place to continue brushing on top of your gum line and your tooth is right in the very back of your mouth, right behind your molars. Most people, when they're brushing their teeth, they take their toothbrush and they just stop right at the very back of your mouth. But really, you're supposed to take your toothbrush and kind of angle it around your mouth. And I know this is a very awkward position, but if you can just take your toothbrush and cut around your mouth and get to the back of the molar, so much plaque builds up there because most people don't know to brush their teeth back there. But simply just moving your toothbrush a little bit back there and scrubbing to get the excess plaque off will make such a huge difference, and I promise you it's going to change the way you brush. So now that we've talked about brushing, I want to talk about another big factor that most people don't ever do, and I know I'm just as guilty as this, is flossing. So I know that I don't floss every day, and I'm sure most people don't. Just gets to be crazy hectic and super annoying, and it's just something that I totally skip every day. But I learned a lot of good tips and tricks on how to actually floss and how to do it the right way and making sure that you're getting the best results out of flossing. So the biggest thing that people don't do is get enough floss. So you want to make sure you get a decent sized piece so that you're able to wrap it around your fingers so you get the best control while trying to move it throughout your teeth. So getting the biggest, like a nice size, is decent. And most people wrap it around their index finger, which I know I've done this a lot throughout the days, and I've just been able to kind of rotate it with my thumbs and been able to do it that way. But I learned if you wrap it around your middle finger, do it like this, it allows you to have more control and more movement and drive within your mouth and being able to floss and being able to just kind of control better than doing it on your index finger. Now, obviously, doing whatever's comfortable is best for you, but these are just some good tips and tricks that I've learned while flossing. So most people don't know this, but when you floss, you're not supposed to go up and down on your tooth. That kind of just defeats the purpose of flossing and defeats the purpose of getting the plaque out in between your teeth. So the right way to floss is obviously twist it around your middle fingers so you can have the best control. Get a decent sized piece and leave enough space. Go down between the tooth, make a C shape, and kind of get the sides of your teeth and then kind of the bottom. So I'm going to show you. Okay, so here's the mouth. You're going to go down on the tooth, to the side, to the other side, and come up. That way you're able to get all the plaque out of the sides of your teeth and you're not just going up and down on your tooth, which kind of defeats the purpose of flossing. So I hope while watching this presentation you learned some good tips and tricks overall about your mouth and to help better your home care and just improve the way that you look at your home care and how you take care of your mouth so you can have a better clean when you go to your dentist.